During the exam, especially for the nephrology DM or DNB resident, Viva, the imaging section might be there. During that time, you might get these kind of images that you are seeing in the background. So we will discuss few points regarding this particular image. You can go through the image. I hope it is clear in the background. So this is NCCT, non-contrast CT of the KUB. What section? It's a coronal section. You can see the right and left kidney. There is one prominent finding on the right kidney. You can see a hyperdense some object over there. Hyperdense lesion or hyperdense object is there. What is that? This hyperdense, this much is stone. It's a CT of a renal stone disease patient. So where is the stone? The stone is exactly in the urine draining pathway. That is the pelvic alical system. So here the questions might be why you are saying this as NCCT. Suppose if only this particular section is given, very difficult to. So whereas if you get entire film where you have to focus on the vessel, especially the aorta and the IVC, where you can able to see the contrast. And only this particular section is given, the kidney is not brightened up in CCT, that is contrast enhancement is not there, so it is NCCT. And this is the investigation of choice for the renal stone disease. And stone is this much big, what it could be. So out of the 4 type of stones, grossly we can divide it as radio-opaque and radiolucent. Both radio-opaque and radiolucent, both stones can be visible in the CT. As the size is bigger, most likely it might be a two-white stone. Whereas this patient, the particular section image, the patient presented with the right side flank pain, there was no other symptoms. In the ultrasound, it will be a bit difficult to know the exact dimensions of this kind of stone. So CT subsequently was done, which showed this. Subsequently, the question the student might be related to the type of stone, stone composition, the treatment plan. And here one point I want to mention is, even though stone is very big, especially in the pelvic alical system, the kidney is not swollen. Mostly the kidney goes for hydronephrosis whenever the pathway is entirely blocked. Here most likely if it is not treated further, the pathway might go for the blockage. Once the pathway is blocked, the entire kidney will start getting swollen. So once the swelling occurs because of the kidney capsule stretch and also the vagus innervation, which is also innervating the GI tract, patient might develop vomiting. Then the cortex might thin out, the pelvic alical system hydronephrosis will develop from this stage onwards. And in this patient, unfortunately his uric acid was so high, most likely uric acid stone, it could be at least pertaining to this case. So yes, that can also reach this much size. So they might ask, what is the sections of the CT, axial section, coronal section, sagittal section, which section it is, this kind. And another point it could be right kidney, how you locate it, because it is exactly below the liver. That side you can make out the spleen. Ureter stone also better visible in the CT. Now coming to the treatment option. What are the treatment options this patient is having? So treatment option, percutaneous nephrolithotomy, removing the stones, or retrograde surgeries are also possible. PCNL depends on the further things like KFT have to be done if kidney functions are normal. Most commonly PCNL or RIRS. Retrograde, they will go remove the stone and come back. Just you should know broadly what treatment options are there. So how to prevent the recurrent stone formation? For that you should be knowing the etiology, why the person developed this kind big stone. Etiology should be targeted. So urinary stone promoters, stone we can say factors preventing stone formation. Those things you should know. For example, citrate is a good stone formation preventer. That one question might be related to that. And to be more specific, you might have to get the 24-hour urinary sodium, potassium, uric acid, calcium, phosphorus, these values. That is called 24-hour urinary metabolic profile. Based on the report, subsequently, we can manage things to prevent further stone formation. Probably that kind might be an in-depth discussion for a final year DM resident. So this is what related to this particular image. So to conclude, it is NCCT, coronal section, a big stone in the pelvic calcium system without much hydronephrosis. Bye bye, we'll see you in the another spotter.